Okay. I'm doing this as an update to everybody. Just so y'all know what's going on with me, with everything. Um, so I just got discharged over here from another ER. I didn't go back to the urgent care clinic, Kaiser Permanente, Cap Hill location, because of the previous video that I've uploaded, where they just basically refused to help me. I understand that, I was hysterical, I was scared, I was terrified, I maybe shouldn't have used certain words and language that I did, but at the time I was scared. And, I felt like also maybe that was the only way they were going to do something. So that's what I chose to do. It was partially planned, but not to that extent. I mostly just wanted to be like, hey, listen, just help me, please. But just the way they reacted, and their you can hear it in the video, their responses to me, their receptiveness and their unwelcoming and dismissive and apathetic attitudes towards the situation and to this coronavirus outbreak, and literal pandemic globally, internationally, is just, to me, is just horrendous. I don't understand how people can be like that. So that's that. As far as that video, like I said, yes, I get it. They were doing their jobs. I know it's the CDC. It's, not the nurses and the doctors, but the people who I talked to in the video that you hear, they weren't nurses. They weren't doctors that I know of. The one lady who said I shouldn't be speaking like that, you don't need to use that language, she was just the receptionist, the secretary, or whatever the first person is you go in when you check in. So I know she's not. She might work in the medical field. I don't know if she is or not a nurse. I don't know, but if that's how people are going to receive you when you walk in, asking for help, then maybe look for another job. And then the other lady who interjected, I don't know if she was or wasn't a doctor, who said, hey, that's not okay. To which I said, it's not okay that you're not helping people. And I've been here twice now. This is my third visit. She said, I believe she said, well, we are helping people. I said, no, you're not, because I've been here 3 times now, and you're not. I mean, this is my 3rd time here, and you're not. I'm not getting any better, not significantly better. So I mean, that's that. That clinic, that people, those people there, I feel like, really mishandled the situation, everything from start to finish. They just kept coming back, as I wasn't getting any better. I don't know if it was just to get money out of me. I don't know. I don't want to speculate. I don't want to assume. I don't want to, put any blame on anybody or anything. Like the nurses and doctors, I get it. You're doing your job. It's the CDC mostly and the government, maybe locally on a state level and federally, because of the cuts to the CDC, the lack of preparation, maybe resources, maybe just a lot of different factors, I guess, that played into this. But at the same time, like, we have a responsibility to each other, to everybody, which gets me to my next point, that my main reason why I came in looking for help is because I don't want to get other people sick. I don't, want to have somebody get sick because of me, because they told me I was fine twice. I was out and about from Tuesday till Saturday of like last week, when they said I was fine. And, potentially could have affected a lot of people in that time. They said I was okay to take proper precautions, which I did. I did quarantine myself as much as I could, but I still needed stuff to do. I have a job. I have things that I got to take care of. I got family and friends, that worry about me. They need to see me sometimes, and and I just needed to also get out of the house. So I really just wanted to express that. That's my main thing, because people are literally getting sick and dying here, and some people are trying to downplay it. Some people more than most. The main demographic of people that have been questioning me, maybe not me personally, maybe this whole coronavirus outbreak, the pandemic, maybe the extent and severity of it. They're like, oh, it's just a flu. oh, it's just only like so many people have died. I'm like, okay, that's fine. But if even one person dies from this, obviously it's been more, but if even one person would have died from this, and this all could have been prevented, that was one too many. And this all could have been prevented. And this, I believe truly personally, and I'm not trying to get political here, I'm not trying to, like, sway things in one way or another, left or right, but this does really feel, I really do feel like this falls on the hands of the president, President Donald J. Trump, because not only did he make cuts to the CDC, but his response, or should I say his lack of response, and the administration and the CDC's, whole handling of it is just grossly inappropriate, is just so, I don't know, like, just maybe like inadvertently malicious, I just can't believe it. I really can't. And which brings me, to my other point that, me being an American citizen, I am Mexican American, but I was born and raised in Southern California. And best place in the world, by the way. I'm always gonna love that place. And, I was born in San Diego County. I won't say exactly where, but I was raised in Paris, California. Which if you're from there, if you know of the area, especially back in the day, the 90s and in the early 2000s, in the 2000s, like, it was a rough area. Certain things went down that, maybe was a little crazy to some people, but it made me who I am. It made me proud to be Mexican, American, Chicano, Californian, and American. I was there when 9/11 happened. I was there when there was basically a race riot at our high school, at our middle school. I was there when, a lot of significant things, I guess, that, shaped this country and my life happened. So that's, I guess, why I speak to it as much as I do, and why I feel like without all of that and everything that's happened in my life, especially in California, like, I wouldn't be who I am today. With that being said, yes, I am an American citizen. I'm born and raised here. And despite all of these privileges and benefits that I have a union job. I'm through the Teamsters, like Local 117. Like, I love my union. They've helped me out. I actually make close to a living wage. Not quite there yet. But, it's a lot better than other jobs that I've had. Significantly. I can actually save money. I can actually pay bills. I don't have to worry, that I won't have enough money every week to, survive. I have these great medical benefits. I have these great privileges and insurances that I pay into, the union, for union dues and everything. Like, that doesn't make me mad. I don't get upset that they're taking, dues, right? Because that's what it's for. Because they protect you. They're like, it's the brotherhood. It's not, just these leeches or these gangsters or these, because somebody saw The Irishman. Now everybody thinks that we're just a bunch of mob guys. We're not. We're a union. We're a brotherhood. We watch out for each other. And I'm really hoping that they do help me out with this. Because, like I said, I haven't worked since last Tuesday of last week. I'm having to use my vacation time to cover this, because my time away, because I've used all my sick time that I've accrued. Go USA, right? Healthcare system's great, and my job is amazing too, that they're so understanding. To an extent they are, to an extent they're not. I get it. They got to protect their assets too. They got to protect the company. They got to protect their interest. Fine. Whatever. I get it. But also, people are getting sick. People are dying. This needs to be taken seriously. And I personally feel like people are not taking this seriously in any way, shape, or form, from, starting from the grassroots level, from people in their local communities, because they're not aware of the situation, because people aren't saying anything. Medical facilities are not saying anything. Doctors, nurses, they're not saying anything. So how are you gonna know, right? Like, I had to go 3 times to figure out that they're not gonna help me, that they're not gonna test me, right? And that was baffling. It was shocking. It hurt. It hurt that they were so unwilling to believe me, to, you know, just dismiss everything that I said and was feeling, and, you know, was seeking, literally begging, having a panic attack in the video, you know, that I uploaded, that I recorded, for help. I'm crying. I'm having a panic attack. I'm terrified. I'm scared. And even then, that wasn't enough. You know, so I get it. Like I said, and my main thing is, if I, right, who have all these privileges, all of these benefits, all of these, you know, great things about the US that we're supposed to love and cherish, right? And I still basically almost got screwed over, right? And that, to me, speaks volumes. Because imagine somebody who's not as privileged as I am. You know, my non-English speaking communities. You know, people who don't have access to healthcare even, or even have means to pay for it, medical insurance, you know, benefits, what have you. I mean, look at the xenophobia going around now towards the Asian community. Like, seriously, like, xenophobia, fear leads to racism, leads to terrible things, to tragedy. And we don't need that right now. We need to be united, and we need to be helping people. And that's why I feel like, you know, I needed to speak up also, because people don't know what's going on, what's happening, the extent of it. And like I said, for all my people, you know, my marginalized communities, my people of color, you know, poor people, we have a great, big, you know, homeless population here. What about all of them? You know? What about, you know, I'm not trying to get into whataboutism, you know, all of these what if scenarios. I'm just trying to be as honest and upfront and direct as possible and real, because I feel like people need to know, and they don't. And efforts are being made to keep people in the dark. Maybe, I get it. We're not trying to cause a panic, and I'm not trying to do that either. I'm just trying to keep people informed, because if I didn't know any of this and I had to go through all these things to, you know, to get to where I am now, like, imagine somebody else who doesn't have the means or the benefits or the, you know, all this. With that being said, you know, like, despite all my great benefits, all my protections, and all these privileges, you know, and I'm not seeking pity. I'm not asking for help. Everything's gonna work out fine in the end. I always believe that. I have this great, stupid, dumb luck that always works out for me for some stupid reason. So I don't worry about anything. And also, like, I'm an able-bodied, healthy, young man, so regardless of whatever happens, I'll be fine. I'll be alright. I'm always gonna be okay. I don't know about other people, right? Like, we all know, or maybe we don't know, you know, how expensive a funeral is, burying somebody. You know, and that in itself, I feel like, you know, is a whole other issue there, because the president really should be paying those families who have lost loved ones every single, like, every medical expense to the last cent, everything about the burial, the cemeteries, you know, everything that had to do with this, their deaths and their loved ones and their sickness, like, they need to rectify, because this is their fault, and this all could have been prevented. Now, with that, like I said, I'm broke as fuck. I'm not gonna lie, this whole thing has tapped me out. My bank accounts are negative. I had to ask my roommates for help paying my rent when this all happened. And even now, you know, I don't know what's gonna happen. I don't know what I'm gonna do at times. Sometimes, like, yeah, I get depressed, I get sad, I get angry. You know, because people are like, oh, whatever, just a flu. All right, yeah, but like all these medical visits, all these doctor visits that I've had to go through and go to, and despite all my privileges and benefits and insurances and whatever, anything that I pay into, I still and broke. And that's not even with, paying off the other visits that I've gone to. I had x-rays, I had EKGs, I had, tests done. Each visit is not cheap. Each visit is expensive as, as hell, for lack of a better word. I want to swear in this video because then people will say, like in the other video, that I was being too aggressive, that I was being threatening, that they are the victims doing their job. And what I want to say to those people who believe and say that, if you're going to believe and say that I'm threatening, that I'm aggressive, that other people are the victims and that they're in danger, then, maybe you should really reevaluate yourself and what you believe in. Because if I'm coming off as threatening to you and aggressive when I'm asking you for help, literally begging you and crying and screaming and yelling and asking for help, granted, the situation could have been handled better, and I could have, not used certain language and words that I did. But I was scared, I was terrified. Given the circumstances, I don't know. I did apologize, to the security guard in the video after. 3 times differently, and he was a younger black male. And I feel like he understood more than anything, more than anybody there. He was like, hey, man, listen. I was like, listen, man, I'm sorry. I didn't mean to swear, to make a scene, to be hysterical, to do this. I'm sorry. He's like, listen, man, you don't have to apologize for anything. I get it. You're scared. We're scared. We're all scared. Like, we don't know what's happening. We don't know what's going on. And regardless, I still say, hey, listen, man, I'm still sorry. Like, I'm not trying to mess things up for you or for anybody here. I'm not trying to do any harm to anybody. If anything, I'm trying to make sure that people don't get sick and die. He's like, hey, man, you don't have to worry, I get it, like, you're good. Which that was, kind of reassuring, because, that's what I was worried about. And like I said, like, I get it, like, but if you see me as a threat and as aggressive and as, somebody who poses potential harm and danger to you, while I'm asking you for help, while I'm seeking help, while I'm begging you and crying and screaming for help, then I'm sorry, but, that's racism. And it is because, even in that moment, if you see me as a threat, as a danger, like, then how do you view other people? In my most weakest, most humbling, most desperate time, and I'm still seen as a threat, as aggressive, and other people are seen as the victims, then, you really need to reevaluate what you believe, how you view me, how you see us, not just Latinos, not just Mexican people, not just Chicanos, all my people, all people of color. Because if that's how you see us, in our most desperate times of need, begging you, screaming, crying for help, then you are a racist. And I'm not sorry about that. I wholeheartedly believe that. And it might be a microaggression. It might be some deep-rooted, I don't know, trauma that you might have gone through, or maybe it's something that you just, your parents taught you, or like back in the day or whatever, or something that's happened that makes you believe that. But you really need to reevaluate yourself, your life, because that's dangerous. That's how people get hurt. That's how, when people are not doing anything and on the contrary seeking help, or begging you for help, or screaming and yelling for help, and you choose to see yourself as the victim, and that they're posing danger to you, and that they're aggressive and threatening, that's how people get hurt. I'm going to be real with you. I'm not going to compare it to other struggles. I'm not going to compare my situation to other things, because, I just don't do that. Like, I'm not going to compare tragedies. But that's not right. With all that being said, to everybody, to the medical staff, to the doctors and nurses, you know, to the city of Seattle, to the state of Washington, to the federal government, the CDC, the Trump administration, Donald J. Trump, the president himself, I just have this to say. I know who I am. I know who I'm not. I know what I am. I know what I'm not. I know what I've done and what I haven't. I know myself well enough, and I'm in tune with myself enough to know, you know, what to do, you know, with myself to an extent, as much as possible. I'm self-aware enough to know who I am. And who I am is Joaquin Martinez Rodriguez Jr. Villamoreno. Now, those last names are very powerful last names in Mexico, are very, you know, names that hold weight. And I don't mean that like, automatically people are going to assume like, oh, he's a cartel member. No, I mean that in the sense that I come from these legendary men and women, you know, back in Mexico and California, everywhere, right? That my family, that they have done things in this life that has, you know, earned them their legendary status. And without getting too much into too much, right? Those are the families, the last names that I come from. I'm proud of that. I'm proud of being Mexican. I'm proud of being American. I'm proud of being Chicano. You know, I'm proud of being Californian. I'm proud of being a Washingtonian, a Seattleite. And, you know, with all that comes this real anger and frustration because of all of this and how I was treated and how I was, you know, just dismissed, not believed, not, you know, just overall just treated in a way that I felt was disrespectful and I felt that was dishonorable. And the reason I use that word dishonorable is because I come from these long line of men and women, these legendary men and women where, you know, back in their day, back in Mexico, you know, back in the day, you know, like honor and respect and love were the three things that you operated with. And that's how I choose to operate my life now. That's how I choose to conduct myself. And I felt like I was disrespected, like I was dishonored, like not even the slightest bit of compassion, sympathy, empathy was thrown my way for my situation at, you know, that Kaiser Permanente urgent care clinic in Cap Hill in Seattle, here in Washington. Now, to all of you, like I said, to them there, the city, the state, the federal government, the Trump administration, Donald J. Trump himself, the president, I got this to say, man. Like, y'all try to break me, y'all try to disrespect me and dishonor me and bring me down, but you couldn't. You didn't. You can't. Because of who I am. Because of my last names. Because if I didn't live up to my last names and my family, that would be a great dishonor to them. That would be a disrespect to them. That would not be loving myself, my families, my people. Now, like I said, that's how I feel. And I'm going to be completely honest with all of you. I'm very upset. I'm very angry. And there's a saying in Spanish, right, that we say, you know, por las buenas soy bueno, pero por las malas soy malo. Y por las malas soy el mismo diablo. Which, you know, roughly translated basically means, you know, do things the easy way, you know, I'm easy, I'm good. If I do things the hard way, then I'm the devil himself. And for a moment, I thought, you know what, yeah, I'm going to embrace this role of being threatening, of being aggressive, of being a villain. No, I'm not. I'm going to embrace this role of being me, of who I am, who I know I am. Like, and I know who I am. And I'm telling all of you, these deaths are on your hands. These people getting sick, it is on your hands. This is your fault. And I'm speaking up for them. And if people want to downplay it, like, oh, it's just, whatever, so many people, or it's just, 12 people, or only some, like I said, if even only 1% have died from this, that's one too many, because it could have been prevented. Because of lack of action, because of willful ignorance. And if that's how people are going to view it, then just kindly don't speak. Sit down, be humble. Don't speak. If you don't have all the information, if you don't have all the facts, of my situation, of anybody else's situation who's going through this, then don't open your mouth, okay? Because nobody asked for your stupid opinion, and nobody's asking for your condescending advice, So just kindly, sit down, be quiet, don't speak, be humble. And like I said, and now, I don't know what I'm going to do next. I don't know how I feel. But I do know that I'm angry. I'm upset. And like I said, the hard way, I'm the devil himself. Now y'all try to break me, disrespect me, dishonor me, show me not even the least bit of sympathy or empathy to me and my situation and my people. And I'm sticking up for all of them. Toda mi raza. You know what I mean? All my Latino people. All my people of color. All my Asian people. My black people. I mean, all my people out here that, the marginalized communities, the poor people of this world, like, everywhere. Because that's who's going to get hit hardest most. Poor people who don't have access to health care, to, the means to pay for these things. And here's the thing. I get it, to an extent. There are these, stereotypes and these things and these reservations that we have toward each other as communities and people, and race, creed, religion, beliefs, whatever. But listen, if you're black, white, brown, Asian, European, South American, African, from Middle Eastern, Asian, from wherever, Australian, like Canadian, like I don't care where you're from. I just care that you're a human being, because we all share this earth, we all share this world, we all live in this, and we all got to take care of each other and love each other, because clearly these stupid people in charge of this whole thing aren't. Not the CDC, not the government, and damn well not the President of the United States of America, Donald J. Trump, and his administration in its entirety. Basically every Republican, to be honest. Like Mitch McConnell, you're an idiot. Matt Gaetz, you're an idiot. Y'all are dumb. People are going to get hit hard. People in rural communities, people who are poor, people don't have access to, health care. People don't have the means to pay for this health care. And I truly do worry about that. I worry about the homeless community here in Seattle. I worry about, the rural coal miners who are out of work in West Virginia. People in the South. Those rural communities who don't necessarily have an access to even a hospital or to a clinic. People who don't speak English very well, maybe. Immigrant communities. People who, undocumented people. Who are scared to even go seek help. To all my people all over and all around the world, all around this country, I'm with you. I got your back. And I'm not trying to be the last thing I want to do. I don't want to take this shit on. I don't. Like, I got other things that I got to go on. I got personal stuff. I got my family that I got to worry about. I got, my personal finances I got to worry about. I got to worry about what I'm going to do next, right? But people need to know. People need to know what's going on. People deserve to know. People have a right to know, because they're not being told the extent and the severity to which this coronavirus outbreak is being handled, is spreading, and is affecting people. With all that being said, when all this is said and done, all those people that try to break me, all those people that try to dishonor me and disrespect me and not show me the least bit of empathy or help, just be ready. Because, I really do believe that I'm going to seek legal action. And if not me, the people of those families that died. And just be ready. Because, you mishandle this so much. It's basically gross and inappropriate criminal negligence, in my eyes, to be honest. And if that's how y'all want to be with me, that's how y'all wanted to treat me, then y'all are going to receive the same treatment that y'all treated me with and received me with. And like I said, man, I'm angry, I'm frustrated, I'm beyond pissed, because this is just starting. The doctor at the urgent care, she admitted, she's like, listen, I believe you do have the coronavirus, but even now, there's nothing we can do. We can't, I can't even promise you that we're going to swab you for a test. I can't promise you that those swabs will be sent out for testing, and I can't even promise you that even if they are tested, that you will be doing anything different. Because, basically self-quarantine, take my meds, take medicine, and ride it out, I guess. Tough it out, tough luck, tough titty, for lack of better words. And that's not right. It's not. And if people don't know that, if people aren't being told that, if they're having to be told that after 3 times of visiting, after they exhausted all their resources, their money, their income, their livelihoods, fuck, then something is very wrong here. If people aren't being told up front what's going on, then somebody needs to. And I don't want to be anybody's savior. I don't want to be anybody's hope. I don't want to be a martyr. I'm not trying to do this for publicity. I'm not trying to do any of that for any reason, for greed, power, and money. I'm doing this out of love, honor, and respect. Like my people, my Mexican people, mi raza, mi gente, my family, my last names drive me to, right? That's why I'm doing what I'm doing, making this video, speaking out, speaking up, raising the awareness, because it's not being told, and that's dangerous. People are dying. The doctor told me this is only going to get worse. This is only starting. And she told me, if I were you, before all the panic starts, because it hasn't yet. To an extent, it has, but it hasn't really yet. And I'm not trying to panic anybody or scare anybody, but listen, like we need to be prepared, we need to be ready, and we need to help each other, but we need to be aware of all the facts, of all the information, and we need to receive that. And if we're not going to receive it from them, then we need to receive it from each other and help each other out. That love, that care, that sympathy, that empathy, that respect, that honor, that we're not getting from them. It's not dignified. Our dignity is not being even taken into account or being acknowledged or being respected in any way, shape, or form. In my opinion. In my case personally. I can't speak on anybody else's. And that's why I'm doing what I'm doing. Trying to raise awareness, trying to let people know what's going on. And I just want you to know that, regardless of your race, creed, color, or religion, man, we're all in this together. We're all here. This is a pandemic that's happening globally, internationally, not just here in Seattle, not just in New York, not just here, in China, not just in, anywhere, right? It's happening everywhere. We are all part of this world. We are all part of this earth. And we need to help each other out. And we need to take this seriously. We need to get the word out. We need to spread awareness. And we need to get on, our leaders, people in charge, to do more. Because if even so far everybody has died, in my eyes, it should have been avoided. It could have been prevented. Lack of reporting of it, all these different factors that go into this, people need to know. And we need to hold people accountable. Everybody, especially the main man at the top, the President Donald J. Trump himself, because, man, you're spreading lies and information and, what should I say, misinformation and things that are making this so much worse. If you're sick, stay home, quarantine yourself, take care of yourself, man. Like, take medicines, drink liquids, try to isolate yourself and try to, not go crazy in your room like I have been. It's hard, but if it means avoiding other people getting sick and people dying, bite the bullet, and I feel like we need to, have a public service announcement, like the government does, or the city, I don't know. People need to just admit to what's going on, not make it any worse, and just, really just tell people, man. Just let them know. Like, we deserve to know. We have a right to know. People need to know. So with all that being said, this is the end of my video. I don't know what else to say. I feel like I've said everything I needed to say and what I wanted to say. So, if you're seeing this, thank you for watching and listening. Sorry for the long video. Sorry for maybe possible ranting and raving. I've tried to express myself as eloquently, as reasonably, as best I could. I hope I did that. I hope people will listen. I hope this will help people in raising awareness and maybe easing their minds and not causing panic, but also, being aware that we need to be prepared. And we need to take this seriously, and we need to do more than what we've been doing, because we haven't been doing enough. Yeah. So, that's all I got. Yeah. I'm with you all. Before we're Americans, before we're Mexicans, before we're Chinese, before we're, from whatever country we might be from, African, South American, European, German, Russian, Chinese, Australian, Indian, whatever. Man, we're all on this earth together. We all share this place. We're all people. We're all humans, man. We need to help each other out. We're not doing that. We're not doing enough. Like, forget all the race, creed, color, religions. Forget what government you're from, what country you belong to, man. We belong to this earth, man. We're tiny specks in this universe. And you know what? We need to help each other out if nobody else is going to. We need to be there for each other. We need to respect each other, honor each other, uplift each other, hold each other up, and acknowledge each and everybody's dignity, so that they do have a dignified life and experience anywhere and everywhere on this earth, in this world, and in this life. And that's all I got to say about that.